Understanding why certain women will only go to female gynecologists.
Somebody needs to take this man to the Barbie movie stat. Okay, but seriously, and you can tell I'm being serious because I have my serious glasses on, but it's really kind of surprising to me that a black man who surely must face racism and judgment as a doctor cannot put himself into the shoes of women who have faced violence and discrimination and medical gaslighting and harassment and outright dismissal for centuries. I really can't understand that. I have endometriosis, which is a condition that requires seeing a gynecologist to get it diagnosed. And despite the fact that the symptoms are pretty straightforward to understand, like now that I actually have the diagnosis, and despite the fact that most of the gynecologists I did see were women, it still took me 11 years to get a real diagnosis. Like, I just got sent round and round, told to take different painkillers, use heating pads, suck it up, go to therapy because it was all in my head, all of the bullshit medical gaslighting. And this is not even accounting for the experiences of Black and brown and indigenous women and women whose first language is not English, who are undocumented, who are transgender, and like, I said that part wrong when I said about trans people. I mean like trans men and non-binary people that have vaginas and still have to go to a gynecologist. For billions of research going into something I probably can't say without this video getting blocked, let's just say men's reproductive health, whereas women's pain gets such little funding and research. Of a Supreme Court of mostly men telling women that, and other people with vaginas, that they cannot make their own decisions about their health care and their bodies. Of states like Nebraska actively criminalizing women making their own decisions about their bodies, and a mother and her teen daughter facing actual time in prison over it right now as we speak. The simple answer is the patriarchy has been actively harming women and their bodies and people who were assigned women at birth and their bodies throughout history. And we don't have any reasons to trust men. Zero. I mean, this is not even unpacking all of the things about the instruments and tools that are used in gynecology and how they were invented by men who had zero empathy for the actual experience of the patient. And just, if you're so concerned about it, dude, maybe try actually like learning and being a part of the change instead of posting content that just shows that you're part of the problem. The fact that you are so confused and cannot understand and had to broadcast it on the internet rather and ask people with vaginas to explain it to you rather than to like take 10 minutes out of your day and Google it. It's not that hard. Like, you probably should have learned some of this stuff in medical school. Do you not know the history of like your own area you've chosen to practice in that like forcibly sterilized black, brown, indigenous, disabled, and queer women for a long ass time. I just don't understand. Somebody explain it to me.